Hey, it's Dr. B, your favorite Psych NP. So today I wanted to talk about the different roles that a psychiatric nurse practitioner can have here in the United States, depending on if you live in a rural area, a city, and even what state you live in, because some states you have to work under a psychiatrist. So this video is going to be a breakdown of different job opportunities and the approximate salary. I think a key takeaway first off is that being a psychiatric nurse practitioner is a niche role. It is also the second highest paid advanced practice nurse role, only second to CRNAs. Another major thing is that there are different niches within the niche of being a psychiatric nurse practitioner, and that's what I want to talk about today. So, essentially, what I'm saying is that you won't get bored because you can move laterally in so many different areas while still being a psychiatric nurse practitioner. All right, the first one and most common place to work is a outpatient mental health clinic. This is typically going to be a interdisciplinary team approach where you have case managers, therapists, nurses, CNAs, groups, a lot of resources that are put into the community, and a lot of federal funding. Some advantages to these roles are they typically have loan reimbursement programs, such as the HRSA loan reimbursement, where you commit 2 to 3 years there and they pay a portion of your school. And historically, they pay a bit less than if you were in other areas that I'm going to mention. But this is the most common place where you're going to get the most experience and you're going to see a plethora of mental illness where 70 to 80% of the population that comes to see you at an outpatient community mental health clinic is going to be on Medicaid, Medicare, or here in Arizona, access, which means that certain medications are going to be limited. And also knowing that this population faces a lot of social barriers from education, lack of food, transportation. Sometimes psychiatric medications are the last priority. As far as how much you can expect to start, I would say start no less than 120,000 per year, and salaries can go upwards of 230 to 250,000 a year depending on the state and where you live. The average here for Arizona for a new grad outpatient mental health nurse practitioner with a master's or a doctorate is going to be 145,000. Next place where you can work is a inpatient hospital or inpatient facility, and this is where people that have exacerbated their outpatient treatment, have medications that are no longer working, or have some kind of significant impact in their life that they have a mental breakdown where they become suicidal, homicidal, or manic, hypomanic, and have a complete breakdown. So in this place, you're going to be stabilizing patients and getting them back to baseline. Sometimes people simply just need to get back on their medications. Sometimes there's substances, sometimes there's both, or sometimes there's an organic change in hypomania or mania that, just needs to be acutely treated, and then that patient can be stabilized and discharged. It is a high acuity, high intensity, um, high stress area because these are some of the most brittle patients that sometimes I remember working in crisis. Sometimes patients would unalive themselves, get sent just in time to the hospital, and then the hospital would save them, treat them, and then discharge them back to us. So this particular population is very unpredictable and unstable, and this particular discipline is going to pay a lot more than other disciplines because of the acuity intensity. The shifts are also going to be more intense. They're usually between 10 to 12-hour shifts, depending on what hospital you work at. In this role, there's going to be a major legal component because you can be at risk to holding people for a 24-hour hold, a 3-day hold, or petitioning them for a permanent hold. There's so many different variables here. Also, there's a risk for putting people in a hold, a physical hold, for an extended period of time, and you are typically the highest authority in the building. So if something goes wrong, it's going to fall back on you. If you give a medication to a patient that is psychotic but has an allergy and you didn't double check, that's on you. So it's a high stress job that is not for everyone. And as far as salary ranges, I would say anywhere from 160,000 all the way up to 275 to 300,000 depending on the state and also the facility. The next place that you can work as a psychiatric nurse practitioner is in an outpatient addictions clinic. This includes a methadone clinic, Suboxone clinic, and essentially you're going to be treating adults 18 and up that are struggling with substance use. And this is a very difficult population because of the amount of relapse, the lack of resources, and also the population that manipulates these services in order to sell some of their controlled substances. I think another complexity here is that typically these patients have medical comorbidities due to lack of adequate nutrition, hydration, so you will have to work closely with a medical provider to provide optimal care and not do any harm. Salary ranges for outpatient addictions can range anywhere from 140,000 all the way up to 180,000 for outpatient addictions treatment. Next area you can work in is exclusively telehealth. There are a lot of telehealth companies that hire psychiatric nurse practitioners, and basically the requirement for you will be to have licenses in several states in order for those organizations to credential you. They're going to take a cut from the appointments that you see. That's typically negotiated, or you can pay a monthly service to that company. For example, Alma, you pay them approximately $120 a month, and you submit all your billing through them. And they also have a wide network of referrals and advertising that all these companies like Headway, Cerebral, Hims, Done, all these companies market heavily. So essentially, they are doing a major piece of marketing for you. Salary ranges here are going to depend on insurances, which ones you're credentialed with. Also, people want to pay your private rate. It's almost like having a private practice without having to worry about any of the billing and someone taking a cut. You can expect anywhere from 50,000 all the way up to 300 to 400,000 depending on how many days you work and how many insurances and how many states you're credentialed in. But it does take a lot of the responsibility compared to having a private practice. So the next area that you can work as a Psych NP is private practice. Now, this is going to have the biggest risk, but also the biggest reward. And it's also going to give you the most autonomy over your life and schedule. So initially, it's going to be difficult to advertise, market, and just let people know that you exist. But once you make that connection, the treatment options and the modalities are completely up to you. Also, depending on what state you're in, you can have full practice authority versus having to pay a supervising physician. So, that can be an additional cost. Now, when you're having a private practice, there's a lot of costs that are going to be added. So, licensing, insurance, malpractice insurance, and employees, if you hire any EHRs, everything is going to fall on you. Supplies, how you want the clinic to look, the memberships that you're going to sign up for to verify insurances. All these things have a high risk, but also have a high reward. I think at the core, what I like about having a private practice is the autonomy that you have. I can take longer with patients, I can accommodate payment schedules, I can be flexible. And I can really provide a service that I'm proud of, and I really am able to help people in my community. So to me, there is really a lot of benefits when you have your own practice, and they definitely outweigh the risks, in my opinion. And I think with private practice, you can make very little money if you decide to only do cash pay or just take a few patients, or you can make a ton of money. It just kind of depends how much you want to work, what insurances you want to accept, sliding scale, private pay, all these things that are gonna, kind of fall and snowball into a successful practice. So if you're still with me, congratulations. I got two more that I'm going to share of places you could work as a Psych NP. The next one being a state hospital. So a state hospital is going to have a high acuity population, but the difference here is that people are going to be committed there and might be under guardianship or have some kind of custody where they are a ward of the state or are going to be there for a long time. So this population can be very stable once you have a stable routine and a good rapport. It can be a very easy and rewarding job because you're essentially keeping these people alive, stable, and helping them become the best versions of themselves. With state hospitals, there also is a lot of benefits that come with the state benefits. It is ever changing. A lot of companies and states are moving to a 401k model versus a pension model, and that can be a factor. However, one thing that I didn't like specifically here in Arizona was the shifts. They were 5 days a week, 5 8 hour shifts, and I wasn't gonna do that. So I think it depends where you're at and what state you're in, and a lot of difficulties can happen because for things to change, sometimes law or statute has to change in order to make that universal and applicable for your state hospital. As far as salary ranges, they are going to be lower and comparable to community mental health, so anywhere between 140,000 to 165,000. But you do have to factor in all those benefits and retirement, and that matters too. And last but certainly not least is the correctional environment. This is going to include transition homes, jails, prisons, halfway homes. This is a difficult population. This is the population I have the most experience with, and there are a few things to mention. Number one, respect is the most important thing that is mutual. That's number one. Number two, it is as a person that worked in prison for 10 years, I was only assaulted once, and that says a lot because my sister, that's been an RN for 3 years, has been assaulted approximately 3 times working in community health. So, that says a lot. Another major factor is that the secondary gains that inmates and detained people try to elicit is complex. They will have a network within a network of the prison to sell medications, sell downers like Seroquel, olanzapine, triliptol, and then try to also sell uppers like Wellbutrin, the manipulation, the cheeking, the using certain diagnoses to avoid having to stay in class for a long time or having to meet other requirements. So I think it is a complex population and a lot of personality disorder underlying conditions. The positive thing about prison jails is that they have excellent benefits and they also qualify to receive federal loan repayment, such as the community mental health centers and the HRSA loan repayment programs that are available, similar to community mental health. Also, the pay in jails and prisons tends to be higher because of that danger and that risk for injury. So I remember I started in 2022 as a psychiatric nurse practitioner making 185,000, and that was a significant amount of money back then, and it still is now. As always, thank you for watching. Thank you for listening. I plan to do a bit more work here on YouTube, so stay tuned. Put any questions down here, and let's all get better together. As someone that started as a CNA and has worked their way up through the ranks over the last 11 years and is now a DNP, board certified Psych NP, I feel very proud, very confident that I can share my wealth of knowledge so you can avoid mistakes and maybe think about things that I didn't back when I started. Thank you for watching, and I'll see you on the next one.